Hi guys, Dr. Berg here. In this video, we're going to talk about the long-term effects of low carbohydrates in the diet, okay? A lot of times when you read the news or get advice from a dietitian, they're going to say, oh, you can do a ketogenic diet for a short period of time, but don't do it long-term because there's so many side effects, okay? So let's talk about that. Number one, there is no essential carbohydrate. You have essential amino acids, that's protein, essential fatty acids, that's fat, but there is no essential carbohydrates. What you do need carbohydrates, you need types of carbohydrates, not for carbohydrate's sake, but for the vitamins and minerals. For example, you need vegetable carbohydrates for all the vitamins and minerals. That's why you need them, okay? Not because of the carbohydrates. Our bodies will not suffer from not having or consuming glucose. Okay, you say, well, we need that for energy. No, you don't. Your body is much better run on fat fuel or ketones, not glucose. Or people will say, well, they'll kind of tie in like a low-carb diet is a low-calorie diet. They're kind of meaning the same, but they're not. A low-carb diet is not a low-calorie diet. They're two separate things, okay? And they'll say, well, low carbs are going to starve your thyroid of nutrients. Well, no, it's not. The thyroid doesn't need glucose. It needs nutrition. It doesn't need a lot of sugar. So when you go on a low-calorie diet, that can make the thyroid suffer simply because you're depriving it of nutrients. Okay, it has nothing to do with carbohydrates. When I recommend a ketogenic diet, I'm recommending unlimited vegetables, okay, by the way. So you want to do a lot of those. We're not even factoring that in. So we need the nutrients from vegetables, but we don't need the nutrients from grains, simply because of the difficulty in digesting grains and the gluten effect that it can create on our body. It turns into sugar very, very fast. And then I always like this. It's like they say, right? They say you shouldn't do a low carbohydrate long term because no one can stick to it and you're going to cheat and you're going to crave. That's not true. First of all, this is the diet that you can stick with because your cravings go away and your hunger goes away. Okay, that's the two barriers of any diet. If you do a low-calorie diet or a high-carbohydrate diet, you're going to be craving and it's going to be hard to stick to that. Or here's another one. They say that a low-carb diet is a high-protein diet. No, it's not. Low carbohydrates and high protein are two separate things. I recommend a moderate amount of protein, 3 to 6 ounces, and that's totally reasonable. And you need those amino acids for building body proteins. And then they say, well, it's not healthy because you're omitting a food group. Well, omitting breads, pasta, cereal, crackers, biscuits, waffles, pancakes. Yeah, you're omitting those groups because those are not healthy, all right? You can get your B vitamins from other foods. You don't have to get them from the grains. Or they'll say that, oh, a ketogenic diet, a low-carb diet is going to lead to a disease called diabetes or create ketoacidosis, which is another lie because ketoacidosis will only occur if you are a type 1 diabetic and you're in a situation where you completely run out of insulin and you have this serious disease, okay? That's completely different than a healthy person doing a nutritional ketosis or a healthy type of ketosis that they're not going to get ketoacidosis, and that's like a severe high acid level of the body. You're not going to get that. It's probably impossible to get it. So you don't have to worry about that. Again, it's like because two words are similar, they're saying they're identical. Ketoacidosis and ketosis. They're not identical. They're similar because they say ketones, but they're not identical, but they're similar. It doesn't mean they're the same. All right. So the truth is that when you do a low-carb diet, you fix insulin resistance. And when you fix insulin resistance, you allow the body to absorb nutrients, way more nutrients. But not just the minerals like potassium, magnesium, chromium, but vitamin A, E, the B vitamins, vitamin D, omega-6 fatty acids. When you have insulin resistance, you can't absorb those nutrients. So the benefit of long-term low carbohydrates in the diet, we're going to reduce insulin. You're going to have heart improvements, weight loss improvements, skin improvements, like acne is going to go away, polycystic ovarian syndrome is going to go away, less liver fat, Less diabetes, less insulin resistance, better cognitive function, better mood, less dementia. I mean, it's kind of a no-brainer, but I do know that every time we have a recommendation that's so positive, you have to have someone that objecting to it. It just always happens like that. So you just pretty much have to realize that, of course, someone's going to object to it. Just ignore that and do a low-carb diet. All right? Thanks for watching. Hey, if you haven't already subscribed, press this little button down below, okay? Thanks.